of us were in leadership there, and a lot of good people came out of Oglethorpe University. If you've been by there, it's a school that's done very well. It's had some challenging times, and now it's doing fantastic. My whole story for myself is I grew up in Atlanta. I'm a Crawford Long baby. Been here my entire life. My dad started his first business in downtown Atlanta, and I started my business out in Gwinnett County, and that's where we are today. We're in Suwanee, Georgia, just off of 85 in Suwanee, and we service the entire state of Georgia. My agency was named the #1 Medicare planning agency for Georgia for 2020. We've been tops for decades now. I've been doing this for 26 years, but it is a specialty. There are a lot of people out in the market that deal with Medicare. You may have seen Joe Namath and JJ Dynamite, Jimmy Walker on TV, and all these people pushing Medicare. But in Georgia, there's really only about 5 or 6 of us that are true Medicare nerds. And I'm talking nerd with a capital N, where we really deep dive into this and understand the specifics and help people year round. This is the reason I have 10 employees. I have myself and 10 employees is because it's not about setting it and forgetting it. So many people think I sign up for Medicare and it is static and I just set it. That's not the way it works. Medicare since 2005 is something that you manage. So that's the way we built our agency over the last 16 years, is this management mode of helping not just seniors, but also their families. I have a lot of 50-year-olds that give me hugs. They're like, thank goodness you're around to take care of this, because I'm taking care of my 75 or 80-year-old mother, and I don't know how any of this stuff works. And we help them, and all of our services are free. So that's the next thing that's really great about my business, is that I get to behave as a social worker, which means I don't charge for our services. We don't. And Medicare pays us through the system. So let's talk about some compliance. This presentation is for educational purposes only, and I don't work for Medicare. I am certified and authorized for all the programs, everyone in Georgia, but they then tell the programs what to pay me for doing the work for you. So it doesn't come out of your pocket. It's authorized through the system, and we take care of all of that. But we're not going to talk about any of the programs' names or prices, those things today. We're going to talk about how to make you a better Medicare consumer and how to understand the topic of Medicare. And there's additional educational flyers up here. There's also our YouTube channel. It's a blessing of COVID that we got to start teaching a lot more virtually and hitting record and putting all of our classes online. So there's a whole YouTube channel, but also our website that has an entire resource library of all of this information and more, including the 3 flyers that we've given you in front of you. There's another 5 or 6 up here that are of other types, of other subject matters. Is anyone here still currently working at an employer providing health insurance, group insurance? You are? Okay. All right. Well, there's a flyer on that subject matter up here. We had a big deal this year. We had a big deal this year during COVID of people being furloughed, laid off, deciding to retire early. It was a big year for people leaving group health insurance because of COVID. All right. Here's our disclosure. Of course, I don't work for Magellan Planning Group. We're separate entities. All right. Affordable Medicare Solutions is my company, but the subject starts in 1965, the year before I was born. 1965, the government created Medicare and created Medicaid. Medicare and Medicaid are 2 federal programs, and those programs, Medicare is for health insurance and Medicaid is also health insurance, but for the poor, for the indigent, and certain other circumstances. Well, there's also veterans benefits, and there's also the Affordable Care Act. Well, you can have group health insurance, veterans benefits, and Medicaid with Medicare. That's allowed. They can coexist together, but the Affordable Care Act and Medicare cannot. So this is a big problem where people who had retired early, they're 64 years old, they take an Obamacare plan, a personal health plan, and they stay on it even though they're qualified for Medicare. They have to go into Medicare. And so that is a big warning, and generally the Medicare plans are better than the Obamacare plans anyway. So back in the 1960s when they created this, they said, look, we want people to have health insurance at retirement, and the typical length of lifetime back then was 65, 66, 67 years old. And they said, we're going to start this at 65 years old, and it was meant to be a temporary health circumstance for the people that had retired. Well, that's not the way it works today. People are living much, much longer today. So we're going to have 25% of America on Medicare very soon. We'll have 85 million people on Medicare soon, like within 6 years. And so that was the original design. You're 65 years old, you've been working, or your non-working spouse was married to you, and they also qualify for Medicare. Well, some people raised their hands and said, look, Billy Bob got hurt at the factory, and he can't work. He's 58 years old. What is he going to do? So they created Social Security Disability. It's a little income safety net program for people that get injured or get hurt, whatever. And then after they've been on that program for 2 years, they get Medicare. So they started getting people before age 65 Medicare. Today we have 10 million people under 65 on Medicare. And then this number 3 item is another eligibility that people that have had diagnosed with Lou Gehrig's disease, ALS, or kidney failure, end-stage renal. They say, look, these people aren't even going to live 2 years if you don't start putting them on kidney dialysis. So they give them Medicare as early as 4 months into their diagnosis. So we're expanding that. There's more and more diagnoses that get people Medicare early. They're looking at 3 or 4 more to add to the list. But we're going to stay in the 1960s because healthcare was totally different. My dad's a retired doctor. His first business was in the basement of Doctors Memorial Hospital, which was right next door to Crawford Long Hospital. And he said people back then used to go to the hospital and stay there waiting for their lab work, 3 or 4 or 5 days just sitting in the hospital in a bed. When my mom had me, she stayed in the hospital a week, I think because she didn't want to go home and deal with my 2 older brothers. But that's what you used to do in the hospital. You'd go to do exploratory surgery. You would wait for your testing. That's just not the way it happens today. But when Medicare designed this program, they thought the hospital was the end-all, be-all. That's where everything happens. That's the center of healthcare. And they made that part free. It's called Part A. But the outpatient portion of Medicare was kind of an afterthought. That's for going to see your doctor, doing some things. And that's Part B. Well, today, more than half of Medicare spending is outpatient because you don't go to the hospital. You go get an MRI. You don't get exploratory surgery. They just take a picture inside your body. And if you need lab work, they do it and give it to you that day or the next day. You have your lab work back. Well, that's outpatient care, and there is a premium for it on Part B of $148.50. It used to be $83 a few years ago. And it might be $160 next year. They change that premium every year. And some of you may have heard that there's a very good chance we're going to see a 6% increase to Social Security checks this year. Well, if they give somebody a 6% increase on their Social Security check, which is an extra, $12 to $18 a month, they're going to raise the Medicare premium $12 or $18, okay? So don't go out and buy a new boat just yet. They're going to spend your money for you, okay? But if they don't give you a Social Security increase, they are not allowed to raise your Medicare premiums. So we had that some years where some people were paying different premiums than other people because if you delay taking your Social Security, they can raise your premiums, but if you're already on Social Security, they can't. So this is what happened. Remember, from 1965 all the way till 2005, the government did not modernize Medicare. Every other health system in the 1980s and 1990s, corporate health care, they were modernizing. They were doing neat and new things and finding new ways to give people health care, not the government. The government was very much sluggish and static. And they said, look, if we're going to modernize Medicare, 2 things we got to watch out for. We want to make everything optional because we've got 30 or 40 million people on the program at that point, about 35 million. And what do 35 million seniors do every 2 to 4 years? Vote. And they did not want to upset seniors, so they said, if we're going to create this program of modernizing Medicare, we're going to leave them alone. If they don't agree with us and they want to stay where they are under the original pathway, number 1 of Medicare, let them be. We're going to leave them alone and not force them to change. So every change they decided to make starting in 2005 under the Medicare Modernization Act was optional. If you want a drug plan, it is optional. It is not forced upon you. If you want to try out new options under Medicare, it is optional. And sometimes having too many choices is overwhelming to people. But the government has created 2 different pathways, the traditional option of Medicare and the new modernized side of Medicare. And this is what we're going to go over a lot. But if you compare this to the Affordable Care Act, they changed everything from 2010 to 2013-14 almost overnight, and it disrupted the system, and there was huge amounts of angst and anxiety and problems from doing things too fast. But Medicare is doing this over 20 years. from 2005 to 2025 is a general big change in Medicare, and you're not hearing it on the news that there's massive problems. You don't. And I get calls every year from my clients saying, oh, I heard there's a problem with this hospital and my doctor. I said, that's the Affordable Care Act. You're in Medicare, so let's look at your Medicare situation. And they get panicked because they get emails or things they hear at church and whatnot. So I have to calm the nerves a lot of times. But let's stay in the 1970s because remember, the government wasn't modernizing, but the insurance companies love to hear when people complain about little things that they might be able to fix by selling somebody something. So insurance companies all over the United States started in the 1970s creating little miniature insurance policies to repair the holes in Medicare. And they started selling different plans in Wisconsin versus Georgia versus Texas. And the government finally in the 1980s stepped in and said, look, this is crazy. We're going to standardize these products nationwide. It's the first time the government came in and standardized a healthcare product nationwide. That was in the mid-1980s. They made a mistake. Remember how I told you Medicare has Part A for hospital and Part B for outpatient? Well, some bureaucrat thought it was wise. I'm not allowed to criticize the bureaucracy, but some bureaucrat said we ought to start naming these new insurance policies with letters. Let's call them A, B, C, D, different codes based on the coverage. And that instantly made Medicare even more confusing. So just remember, if you use traditional Medicare, you have your Part A and Part B Medicare card. You have now your Medicare Supplement. The green and blue sheet that's in front of you highlights what we're going to go over on that. And then you have your drug plan. This is a 3-card system. No other place in healthcare do you have to show 3 cards. Your Medicare card, your secondary card, and your drug card. But that's the way it was designed over 50 years. It happened this way. So when the government said, we're going to come in and fix this or try to fix this and modernize Medicare, we don't want people to carry 3 cards. So under the new side of Medicare, the pathway number 2, it's called the Advantage system. This side of Medicare is a 1-card system, just like you had when you worked at your employer. You get from your health plan at work your card, and that's your health card to show to the doctor, the pharmacist, and the emergency room. And that is your health ID card. Well, that's what happens here. You don't have 3 cards, you have 1 card. Now also what happens is your hospital coverage, your outpatient coverage, which you still have to pay for, they're built right in, including the drug plan almost always is built into these new programs. So you have a single card for your pharmacist also. And now, when you see these words, extra coverage, this is what Dynamite J.J. Walker and Dynamite Joe Namath are talking about on TV. Get your extra Medicare coverage. They're talking about these programs. But we're going to talk about that in depth in a minute. But the big issue is these programs utilize what are called networks, HMO, or PPO lists of doctors. If you choose an HMO plan, that means you have chosen a restrictive list of doctors. Your doctor might be there this year, or your hospital might be there this year, but it is a insulated network. You can only go outside that network if it is an emergency. And PPO plans mean you can go outside the network at your option. So in-network, preferred providers, or out-of-network, PPO, which means you get to make the choice nationwide. So HMO means restrictive network, mandatory, and PPO means optional network. And remember, you still have to make your premium payment called Part B of Medicare. You still have to pay that $148.50 this year, every year. I've given you a lot to take in. And people stop me a lot of times right then and say, well, just tell me what most people do, Keith. It's not that easy. Medicare has found over the last 8 or 9 years that it's a 50-50 coin flip. Half of the people at age 65 are choosing traditional Medicare, and half are choosing the new plans. If you add up everybody in Medicare, including the 100-year-olds and 90-year-olds, it's 40% of people are right now under the new side of Medicare, and 60% are under traditional Medicare. And Medicare expects within the next 5 years it's going to be, over all age populations, 50-50. This is what we're seeing, including the low-income population. Now, if you've lived in Atlanta as long as I have, you know who Clark Howard is. One of my heroes, a fantastic communicator for consumer issues. He likes to make things as simple as possible. And I love Clark. I used to take care of Clark's mom for her Medicare before she passed away. Well, this is how you look at this subject matter. It's 3 things to consider. The first column right here says, what doctor can I go to? The second column right here is, how much is this going to cost me out of my monthly budget to participate in or buy this plan? And then the third column is, what the heck is this going to cost me when I get sick to get better? It's who can I see, what's my monthly budget, and if I get sick, do I have to spend any money? But even easier than that, this is very much a Clark Howard thing, is what your grandmother and your grandfather taught you. There is no such thing as a free lunch, unless Kevin's buying it, right? And then it's free, right? We got some lunches back there, I think. All right, so this is the point. You either prepay for things, you don't get a free refrigerator, you might buy a warranty, and then you get a free refrigerator or a replacement or a tire or whatever. You prepay for things. If you want to send your money off to an insurance company by buying an insurance policy called a Medicare Supplement, you just do that. You send off $150 a month to the big company, and then they're required, they don't get decisions, they're required to pick up the bills that Medicare leaves behind. Matter of fact, the supplement doesn't even talk to your doctor, it doesn't talk to your hospital. It is laying silently in the background. You just pay that money, and then the system just runs it through, and the supplement pays your bills. That is prepaying for your health care. And then paying as you go means that you don't spend money every month. Most of the new plans have a 0 premium, but there's a trade-off. You're going to have to pay money to get your health care, your $5 to your primary care doctor, typically $30 or $40 to your specialist. Copays. If you go to the hospital, you're going to have to pay $300 every day you're in the hospital, maybe for the first 5 to 7 days. After that, it's free. But that adds up. $300 a day would be $2,000 over a week, right? $2,100. But let's use me as an example. I'm not as young as I used to be, not as sure-footed as I used to be. So I was skiing in Park City, Utah with my friends in February. Had a great day, went to the top of the mountains, double black diamonds. They were about to kill me. They're 10 years younger than me, and I was keeping up with them barely. And I get home, we go to eat dinner, and I go back to my condo, and it's pitch black. They have lights in the parking lot, not down by the condos. And I slipped on my stairs and broke my ankle. I should have a better story. I should say I got hurt on the black diamonds, right? Well, I had to fly home. Next day or so, I flew home, ruined my trip. And my surgery on my ankle, because I'm on an Affordable Care Act plan, was $7,000. $7,000, more than my ski trip cost. Now, if I would have been under a Medicare supplement, I would have been able to see any doctor nationwide. I would have spent about $150 for my supplement, maybe $30 for my drug plan. My Affordable Care Act plan is $650 a month. But I would have been able to brag that my ankle was free. I would have paid anything for my new ankle. I would have gotten a free ankle. Under the Advantage plan, I would have picked my doctor out of my PPO list of doctors, which my Affordable Care Act is an HMO. I would have picked more doctors under the Advantage plan. I would have paid $0 per month, except my $148 I'm paying to Medicare. And my ankle would have cost me about $400 or $500 for my new ankle. Either one of these options is light years better than the plan I have. I am jealous that you have these great options available to you. Okay? It's just a matter of what kind of consumer are you. Do you want to prepay for your health care and have total flexibility, or do you want to have the new plans where you don't pay much money, you're going to choose from a network, and you're going to get some extra benefits, and we're going to go over those extra benefits. There's no right or wrong. I have 5,000 clients. Half of my clients use traditional Medicare, and literally half of my clients use the other side. And it is, I'm talking like 49.8 and 50.2. It's that close. Don't get excited about any plan, though, until you make sure it's a good plan. Most plans are in a good of average or above average range, which is the 3 and 4 stars. This is called star ratings, 1 to 5 stars. 1 is bad, 5 is good. Very infrequently do we have low-rated plans these days. It used to be, but the market has gotten very stable, and that doesn't happen much. 88% of plans are in that 3 to 4 star range, and they start getting bonuses. Once they hit these higher ratings of 3.5, 4 stars, the government pays bonus money to the plans, and rarely do we ever get to a 5-star plan, and they get extra bonuses, the highest bonuses from the government, and then they also have the ability on a 5-star rating to enroll people every month of the year, whereas other plans are limited to certain months where they can enroll people. So this is important. Every plan that you ever look at is required to tell you their star rating. And that is something that is you do need to pay attention to. If you receive a letter from your plan that says, hey, we stink, we're 2-star rated, they hate to send that letter, but that's a federal mandate. They have to tell you that. All right. So we've done a lot of talking, and I'm going to cover a huge amount more. But I want to stop to make sure to see if there's any questions before we go forward, because we're going to spend a lot of time on prescription drugs, which is a huge issue for seniors. Any questions so far? Yes, ma'am. Sure. Yeah. That better? Okay. Yes, sir.
I may have missed you saying it, but on the Advantage plan, do you not get to choose your doctor? Or do you?
Under a PPO option under Advantage, you have the ability to choose your doctor. You can go in the network and choose a network doctor, or go outside the network and choose a doctor who's willing to see you, who accepts Medicare. That's a great question, because under the HMO plan, you have to use the network. You can't go outside. It's forced upon you. And the HMO networks can change more often because they're more restrictive on the doctors. But under original Medicare, not every doctor is seeing new patients. A lot of doctors limit their practice load, right? Or they're getting ready to retire themselves. So you always need to ask before you start to see a new doctor, before you schedule that appointment, are you accepting new patients? Do you accept Medicare? If you have a Medicare PPO, you want to make sure that doctor, he or she's in that network. That's where you're going to get your best results. But you're not required to. So I have a lot of clients who have homes in Georgia and also, Florida or New York or someplace, and they love the PPO options if they go that route, because they can just use doctors nationwide. And but under traditional Medicare, it's the most flexibility because it's just Medicare. There's no network to look at.
Keith,
yes, sir.
I may be getting ahead of myself, but what about international travel?
Yeah, very good.
Is that available on the
Yep.
Advantage plan?
Yes, it is. Okay, we'll address that right now before we go forward. So under the Medicare Supplements, in this sheet right here that I gave you, if you flip over on the back of that sheet, at the bottom, it says foreign travel. And the plan that is most often used today is called Plan G. And Plan G provides at least $50,000 of foreign travel coverage, a lifetime. Some of the carriers provide $100,000. I can't say names, but one of them is the blue color. Provides $100,000 of international travel. Under the Advantage system, almost all Advantage plans provide international travel coverage. The major plans under the Advantage system provide $250,000 of international travel coverage. The typical plan is going to be $50,000 to $100,000 of international travel. Okay? And some of those aren't even lifetime. Some of that is per incident, whereas under the supplement, it is lifetime benefit. Yes, ma'am.
My husband, well, I'm 65 last month, and my husband is working.
Okay.
I'm on his employer.
Okay.
Health care.
Go ahead.
I want to keep on that. Do I need to, what do I need to do?
Well, first thing I do is I need to give you this sheet. This is the employer sheet, okay? All right, so that's a great question. She says her husband is still working, and she's under his employer plan. If it is a large group, which means 20 or more employees, then you probably will activate only Medicare Part A, the free portion of Medicare. However, if you're using a health savings account, don't do that if you're contributing to it. Okay, you don't have one. Then you'll call Medicare, or you'll go online to your Social Security account and ask for Part A only. And then what that'll do is Part A covers hospital and rehabilitative care, and so it'll help coordinate with your group plan to pay your bills for you. It's a good deal, okay? Yep. It says that on that sheet, but remember, 20 or more employees is large group. Yes, sir.
One more question.
Okay.
Under foreign travel coverage, it mentions travel. What if you're temporarily assigned by your company doing your businesses over there?
Yeah, so it generally is a 90-day rule that you're outside of the United States no more than 90 days. Some plans give up to 6 months. But you'd be careful about that, because if it is different than that, you can buy expatriate coverage, longer international coverage, and I have that extra coverage. Okay? Yes?
What if you're on a cruise ship? Does it cover that?
Yeah. Yeah, outside the U.S. Yep, that's correct. But again, the most expensive thing I've seen in what she just mentioned in international healthcare, I had one client that was in Costa Rica, and it was a $400,000 bill. That's an outlier. But generally, it's the transportation. It's flying somebody off of a cruise ship back to Miami or Atlanta or wherever. That can be $25,000, $50,000 flights. That guy that one time that got married that had tuberculosis that went on his honeymoon in Brussels, Belgium or whatever, that was a $100,000 flight to get him back to Atlanta. So if you are concerned about that, it's not expensive at all to add travel coverage for your trip. If it is a group travel deal and they've got a blanket plan for the group, that's oftentimes a very good deal. If you're doing your own trip, just call me, and we've got great plans through a couple good companies for international, and they all now cover COVID situations. So when COVID first started happening, we had some limitations, but now they all cover COVID. Okay? Yes?
Early on when I was researching, when talking back in 2012 and stuff like that, these Advantage plans, they warned me that you had to qualify every year, and if you had a medical condition, and this, that, and the other, don't go with them.
Okay.
Is it still like
that?
that?
No, it's not.
Okay.
Yeah. So that's a good question. He said, what kind of health questions do you face when you go to an Advantage plan? There are none. There's no question now for height and weight, no question for tobacco use, no question for did you have COVID this year, no question for kidney failure. Kidney failure was our one question we had for a long time. They got rid of it last year. There are no health questions when you enter into a Medicare Advantage program. That is a federal, it's a part of Medicare, it's a federal thing. Now, with the insurance plans called Medigap, with these Medigap insurance policies, it varies by state. Here in Georgia, there are health questions to get into a Medicare supplement unless you are just turning 65 and starting your Medicare or leaving group insurance. There's a few other circumstances where you don't answer health questions. So I just helped a 77-year-old man this week in Braselton, Georgia, a client of mine. I helped him move from a Medicare PPO to a Medicare Supplement Plan F with no health questions. Even though he had stents in his heart and he had declining health, he didn't have to answer health questions because he had a special circumstance. So the average consumer is not going to understand those rules. That's why you see your CPA for the tax rules. That's why people come to me to fit within those rules. Okay? But yeah, since 2012, things have changed dramatically. Yes, sir.
You have clients who switch back and forth?
Yep. Yes, I do.
You can do it every year?
There's, of course, nothing's perfect, but yeah, it's flexible but not perfect. There are rules, yeah. So we're going to go over that. All right, so let's first talk about prescription drugs. And before we, oh, one more question? Sorry, Carol.
I wanted to know, I had an incident with my leg, when I was on a trip.
Okay.
And they, I didn't have to stop the trip, but I was being treated. There was a doctor along on the trip, which was good. But anyhow, I was surprised when I got home. I had to continue treatment, and the insurance would not continue when you got back.
What, are you on Medicare? And
But this was not the Medicare. Is that why this is the travel company or the travel insurance?
yeah, they knew you had other insurance, and so they were defaulting over to the other insurance. Yeah. Yeah. Once you returned home, they're going to default over to that, because that's your base coverage is your deal. And some of the travel plans price the plans whether or not somebody has other coverage. Most people do have other coverage, but some travel insurance will say if you don't have any other coverage, it's a different, price for the travel coverage. All right, let's talk about this. First thing is this green sheet that says how to create a Medicare account, because this goes hand in hand with managing your prescription drugs. This is very important. Anybody that's in Medicare that has at least Part A or Part B or both needs to go onto Medicare.gov and create yourself an online account, just like you do for Social Security. But it's easier here just to set up a Medicare account. And the reason this is so important is once you start in Medicare and utilizing a Medicare plan for your drugs, that pharmacy and the drug plan report your drug usage into your account. So you can see every drug that you've been filling for the last 12 months. or your family can. If you get sick and they don't, what's going on with mom? Well, they can look in your Medicare account and see exactly what drugs you're using. Really handy, because during the annual enrollment period, which is coming up in October, it makes it such an easy process to do the red sheet. The red sheet is, how do I review my prescription drugs? So once you have your Medicare account created, then you can go in there and select the drugs you're using. Just check the boxes, because you don't have to type them in. They're already there. If one is missing, of course, you would type it in. And then you put in your pharmacy. Soon they're going to also know which pharmacy you're using. They know that. They just haven't programmed the thing all the way. And you hit go. And it says, congratulations, there's 28 drug plans in your county. And nobody wants to look at 28 drug plans. It's going to say, look, here's your current plan, and here's the right plans you're supposed to be on, you should go to. And it makes it really simple for the consumer. But let me show you how confusing Medicare, the government, made things. If anybody's ever worked for the government, they know they can make things confusing, right? All right, so prescription drugs, there was no prescription drug coverage 2004 and earlier. Think about that. Seniors paid for their drugs themselves unless they had a retiree plan that gave them some drug coverage, or they had veterans benefits. But most seniors had to fork out of their own pocket to buy their drugs. Now, since 2005, there's a prescription drug program, but one of the big problems in the prescription drug program was something called the donut hole. If you've ever heard that terminology, donut hole, it's an evil boogeyman where you would have your Medicare coverage, and then what would happen is you would run out of your Medicare coverage for a while. That is where you would have no coverage. They fixed that. From 2011 till 2021, they shrank that problem boogeyman down to where you don't have to pay 25% of the cost of your drugs. So if anybody's worried about the donut hole, it's nowhere near the problem anymore. But watch this. Who wants to learn about all the intricacies of a Medicare drug program? Some plans have a deductible. Most plans don't on generic drugs. Every plan is required to give you a bucket of money to use each year. This year it's $4,130. This donut hole now is shrunk down to only 25% that you have to pay. But the out-of-pocket costs went up. It used to be $4,000, and they've raised it to $6,550 to fix this donut hole. And then this catastrophic umbrella. What does that mean? That means that after you've thought you've already spent your $6,500, if that ever happens, very few people do, then the government's going to step in and pay 95% of the cost of your drugs. Now, who's ready to take a test on that one, right? That's a lot of rigmarole. Don't worry about all that. If you have a major problem with drugs, come see me. But the simple thing to do is just do the drug review and let the system tell you, hey, the plan you're on next year is going to cost you $700 for your drugs. And if you look at this other plan, it'll show it right there on the screen. You're going to spend $200 next year. Same pharmacy. You don't have to change your pharmacist or your store. Same list of drugs. You don't have to change your drug. It just says, look, this one's $500 a year cheaper or $1,000 cheaper. The average savings that Medicare has calculated by people doing this simple exercise themselves is $720 a year per person. That's $60 a month. And if people are all excited about getting 6% increase on their Social Security check, that's only $12 to $18. This is $60 a month by just doing this simple exercise of creating your Medicare account and checking on your prescription drug plan. The way it happens is these companies will sell you a plan that's $15 a month, and 3 or 4 years later it'll be $60 a month, but you're not paying attention. It's being deducted out of your Social Security check, or it's just such a small change you're not really noticing it, and not noticing that your plan is $60 a month and the average plan in Atlanta is $25. So right there you're throwing away $35 a month. And then you go to fill your drugs at the pharmacy and you find out, well, it used to be free on that drug, now it's $5. Oh, okay, the pharmacist says everything seems to be fine, and you just roll with it. And that adds up to being $60 a month. This happens millions of times. This is the average. There's 50 million people that have prescription drug programs, and $720 out of your pocket is $720 into the plan's pocket, the insurer's pocket. They are making bank on this like crazy because they know that 90% of seniors aren't doing this, or their adult children that are helping them are not doing this, or they're not asking Keith to do it. This is not a hard process. Don't throw away money. And between a husband and wife, you're talking $1,500 a year. Kevin, what can you do with $1,500? Could you buy, start getting some better long-term care coverage or something else, right?
That's right, Keith.
Yep. All right. I don't know if this would apply to anybody with Magellan, but if you know somebody that is low income, there is help for those people that are low income. It's called low income subsidy or extra help, and the government will step in and pay people's drug programs premiums, and if they qualify also, they'll also drop the cost of their drugs. So if their insulin is, or their blood thinner is $100 a month, they'll drop it down to $9 per month for their drugs, or even as low as $3.70 for generics. They'll also get rid of, for the poor people, they'll get rid of any of those deductible or donut hole. And if somebody gets Medicaid, they don't even have to apply. If they get Medicaid, the government automatically assigns them this extra help for their drug costs. So low-income people get a lot of help. What about high-income people? Well, if there's high-cost medications and you're on some medication that's $5,000 a month, the manufacturer probably has a patient assistance program. That PAP, patient assistance program, is designed to help get drugs into the market, because if people can't afford them, they're not going to use them. So they create these assistance programs to get the drugs going. They create foundations or other chronic illness funds and things to help people. So if you are suffering from multiple sclerosis or liver failure or something and there's a drug, there's probably a program to help you afford that drug. But conversely, low-cost drugs, I use myself, and even for my pet, Goodrx. If you've seen this advertised on TV, it's a yellow card. It's also an application for your phone. Goodrx is great, because even after you find the best Medicare plan, you might say your drug is $10, and you might find out with Goodrx that your drug is $7. It doesn't hurt to check. And it's okay. Just tell your pharmacist ahead of time, for this one drug, I'm going to use my Goodrx card, and for these other 3 drugs, I'm going to use my Medicare plan. You just can't double coupon on one drug, both plans. But it is really effective, and don't let your pharmacist say you can't do that. I've heard some pharmacy techs saying no, but it's my Kroger automatically uses it for me, and it works out great. Let's talk about modern innovations. Nobody would consider preventive care to be this modern innovation. Every health plan I've ever had in my life has given me an annual checkup. At least my mom took me every year to get my checkups, right? I think she was asking the doctor, what the heck's wrong with this kid? All right, so preventive care was not in Medicare until 2005, and they tested it first under the new Medicare PPO and HMO plans. And then in 2010, they said, we're going to give this to everybody. So now all people in Medicare get to have preventive care. 27 different items, whether you're male or female. And your doctor might, of course, want to do a few extra things. You might have to pay a little bit, but most things are free for you under preventive care. But remember, they tested it first under the new Advantage programs. Well, under number 2 here is gym memberships. Medicare does not pay for you to go to the gym, but a ton of Medicare programs give you free access to go to LA Fitness and Ladies Workout Express and all these places. Why? Because they've studied it. People that go to the gym have a 30% reduction in medical care, medical drug bills and medical care. And same thing happens under dental, vision, and hearing aids. Medicare does not cover dental, vision, and hearing aids. Under the new $3.6 trillion tax bill, they're looking at one section under Medicare about how do we add some extra benefits to Medicare. But right now, under almost all of the new Medicare programs that Joe Namath is pushing on TV, almost all of them have a dental component and a vision component. And why would they give you dental care? Periodontic disease leads to digestive disorders and also mental disorders, is what they're finding. If you can't eat properly, maybe you need some dentures, you can get better nutrition. Vision care. Half of all glaucoma is found in a routine eye exam. It's better to treat glaucoma and other eye diseases early. Simple to treat them these days. Drugs that used to be $500 a month are now $1, $2, $3 a month for glaucoma. Hearing aids. They are now realizing that the average hearing loss is untreated for 10 years. And during that 10 years, your brain actually shrinks from inactivity in certain regions. My dad told me, he's 40 years old, and he said he got his hearing aid at 75. He goes, I wish I'd have gotten it at 65. I didn't realize how bad it was. And really changed his life, getting his hearing aids. Now, a lot of the plans will either help buy a hearing aid, give you some money, or flat out buy you a hearing aid. The low-income programs a lot of times have a lot of rich benefits for the low-income people. But this is true. People say, is that really true? Yes. But it doesn't mean it's true next year. If the government cuts the funding, that would be one of those items that would probably start to be deleted out of the programs. But right now, the government is paying the plans $950 a month per person. $950 per month. So they take that funding and add these extra benefits. Well, the last president said, well, why don't we do even more extra benefits for the seniors, and let's give them extra stuff and relax the rules. And so they created the thing under at-home services or additional services that Medicare has never covered. Medicare doesn't take care of you at home. But some of the plans are now experimenting with a couple of benefits, providing at-home care, cooking and cleaning, or Uber or taxi services to get people to where they can go get their vaccine or go to the doctor, not in an ambulance, in an Uber, in a taxi. Also, a very popular item that's in many, many plans is over-the-counter medical items, which means, just like most of my medical care I do for every day, is allergy medicines, vitamins, sunscreen, any of your normal stuff you put in your medicine cabinet. A lot of the plans will just ship to you once a quarter. You just go to a catalog or a website, you order it, and a box of those items just show up on your doorstep, whatever you need. If you need Vaseline, you need allergy medicine, whatever, you just order it and they deliver it right to you. That's a lot of the new plans. Medicare doesn't do that. But what the point is that they're letting the new plans pioneer these things and see if it helps increase people's health care results. And then they're going back to original Medicare. How can we incorporate this now? Is there a cost-benefit analysis? Is it worth it? Let's bring preventive care. Let's bring all these other items into standard Medicare. And that's what part of this 20-year evolution of Medicare is. But here's what's going to save Medicare. Number 4 is the big deal that's going to keep Medicare solvent. Medicare never studied academically who was spending the money. And the insurance companies were. They were using actuaries and looking at all of it and saying, wait a minute. 5 people out of every 100 people spend half of Medicare and Medicaid's dollars. 5% spend half. That's a general rule of thumb. It kind of varies year by year, but generally that's it. It's not you that has a new hip that's wrecking Medicare. It's a chronically ill person that has 2 or more medical conditions. Generally, this is the way it works. These are all rules of thumb, okay? Heart and lung problems, kidney and blood pressure problems, diabetes and obesity. Once they start having 2 or more medical conditions, then their dollars go through the roof. So Medicare is targeting those people now and looking at how do we laser down and get those people extra benefits to either get them better or to keep them from degrading. This is the important part of Medicare. And a simple part of this section is called care coordination. This is simple common sense. Somebody goes to the hospital, they go home. Did they have a heart attack? Okay. Did they get their oxygen when they're at home? Are they going to do their cardiac rehab? Have they finished up their treatments with their doctors? How are they doing? That's care coordination. And when people don't finish their cycle of care, they tend to come back into the hospital quickly or they tend to degrade. And so Medicare has been paying attention, and the hospitals have been pioneering care coordination. So when you leave the hospital, you're probably going to have a coordinator call you. Although during COVID, it's all hands on deck right now. They're trying to, keep the ship from sinking right now. But in general, normal times, they're going to have a person call you now and say, how are things going? Now, staying on time here. How do you get into Medicare and how do you manage your Medicare? The way you manage your Medicare is through different enrollment periods. This means opportunities to get into Medicare or change your Medicare. Everybody that turns 65 or that is awarded disability gets an initial election. That's generally at your 65th birthday month. So you're turning 65 in October, there'll be October 1 as your start date. Okay? And you have 3 months prior to that month, you have that month and 3 months after, a total of 7 months to raise your hand and say, I want my Medicare, before it becomes a special request. That's your initial election. Now, we'll skip the second one real quick. Everybody that's already in Medicare gets the annual election, which is coming up. Starts October 15th. The preview period starts October 1, so I can actually start seeing the plans for 2022 on October 1, and so can you at your Medicare account. October 15th, we can actually start enrolling people into new plans, and that goes till December 7th. Why does it stop on December 7th? It's because the companies have to process applications and print ID cards, and the U.S. mail runs slow. So we've got to have 3 weeks there, and you got New Year's and Christmas in there also. I used to have to work until December 31st on those annual elections. Not anymore, thank goodness. But special elections, if you don't fall into an initial election or an annual election, you are a special case. I'm working, I'm 68, I'm sick and tired of working, I want to retire. Well, that means you're using a special circumstance of losing your employer insurance, and you're going to activate Medicare. Okay, and I'm going to show you how many months you need to plan to do that. Or you're in Medicare and you're moving from Atlanta to Savannah. That is a special circumstance. You've moved. Or your spouse dies and you had retiree coverage with your spouse, and now you need to go into regular Medicare. If you have a special circumstance, that's called a special election, and generally you have 2 months around that event to fix your Medicare. I know how to use those rules to your advantage because oftentimes people forget to change their address at Social Security. They forget that there's also special elections, or they would never know this. This year we had a special privilege due to COVID that allowed me to fix people's Medicare all the way up to August 15th. We had special privileges due to these winter storms, special privileges due to Hurricane Fred, and get this next one. We had special privileges due to peaceful protests, okay? They called it civil unrest, okay? I called it peaceful protests, okay? And then they even gave us a new one. The last President Trump, he gave us extra benefits. That if somebody has not done their annual review, they totally forgot to do it, didn't do it, and they call me in January or February or March and say, Keith, I've got this problem. My doctor's not in my plan or my drug's not covered. I get a one-time mulligan. They get a one-time mulligan January, February, March, first quarter, to fix their HMO or PPO plan. I get a lot of calls from social workers, hospital workers, other people saying, can we fix what one of these things is going to help this client fix their Medicare problem? And we're such nerds that we know all these rules, okay? And I'm proud of it. All right. So if you don't do things right, you're going to have financial penalties. If you take COBRA instead of taking Medicare because you're 66 and your spouse is 64, you shouldn't have done that. COBRA is not acceptable replacement for Medicare. Medicare is primary. You do that, as an example, you're going to create a lifetime penalty for yourself probably. So if you know anybody who's retiring, has got a younger spouse, they will take COBRA as a younger person. The older person will go into Medicare so that they don't end up with penalties under the different parts of Medicare. Part B is a severe penalty. It's 10% per year that you make a mistake. Lifetime penalty. So that's about $15 a month. That's $180 a year. Part D is not so bad. It's about $350 per month per year. But also high income earners. Anybody who has, as an individual, single person, $88,000 or more per year in income, or a couple, $176,000 a year or more, is going to pay a backdoor tax, an increased premium for their Medicare. And sometimes it's because people, I had a lady yesterday, she says, she was doing a presentation, she said, I withdrew $100,000 out of an IRA to help buy our new house. And so she gets a bill 2 years later from Medicare that said, hey, you had this big income year, we're going to charge you extra. Well, she didn't know she could appeal that charge and get it removed. So she's been paying for a year and a half this extra money that she didn't have to. It's about $70 a month. So $840 a year she was paying extra. So I'm teaching her how to appeal that and get rid of that penalty. They should remove it. She says, I'm not rich. I just needed the money to buy a house. Low income qualifiers won't pay the penalty. If they're already in there getting penalized and they become low income, they get the penalties waived. The government's not going to penalize itself when it's trying to help the low income people. This is important. You don't want to make mistakes and get penalized. All right. I know you all feel like you're experts and you're going to be able to pass the test. It's going to be 50 questions coming up. No. All right. 10 more minutes here at most. Remember, Medicare does not cover everything. If you want permanent dental coverage, you buy dental insurance, but don't buy dental insurance until you talk to your dentist. Okay? If your dentist is not in the plan, it's not going to be fun. Some dental plans are worth it, some dental plans are not worth it, but that's the only way you can guarantee yourself the same dental coverage every year, because if your Advantage program has dental coverage on it, again, if the funding gets cut, you might lose your dental coverage. Critical events. Of course, Medicare covers heart attacks, strokes, and cancers. A lot of seniors have told me, Keith, is it allowed if I keep my duck policy, the little duck? And I said, yeah, Medicare says that's fine. If you want to do that, that's your choice. To give you subsidy, extra money during a bad health event, that's fine. Medicare doesn't care. But life insurance, Medicare does not pay to bury people. I've had that question before. It does not do that, so you need your own life insurance. Talk with Kevin about that. Home care is the big one. This last one is the biggest assumption that's out there. People think that Medicare pay for at-home care, assisted living, and all of that stuff. It doesn't. If you need that coverage, you're going to need to buy a long-term care plan, you're going to need to sell the beach house, or you're going to need to have a pile of money, because that can get expensive. Talk to Kevin. But Medicare does provide for 20 days, if you qualify, asterisk, if you qualify, 20 days of skilled nursing rehabilitation for free on every plan. Advantage plans, regular Medicare, it's free. After that point, 80 more days for a total of 100 if you qualify. It's not guaranteed. If you qualify, to help you to do rehabilitation. The way rehabilitation works is when you come out of the hospital, they say, what is this person's health status? What were they being treated for? And what is the scoring? They score the person and decide if they need 3 days, 7 days, 12 days of care. And there's a lot of arguments. The nurses will say they need more. The government will say they need less. The plan will say they need less. There's a lot of arguments that happens under this rehabilitation situation, and especially if the rehabilitation center scores the person improperly, and that is a major problem. Okay, so let's do recap. There are 2 different paths to access Medicare, the traditional or the new Advantage path. Half of people at 65 are doing one and half are doing the other, but it says right here, your decision is not permanent. Don't let anybody tell you that you're making a lifetime decision. Medicare, of course, doesn't cover everything. The annual enrollment period is October 15th to December 7th. And if you're low income or chronically ill, you have special plans and special privileges available to you. And one of the big ones that President Trump did, one of the big ones is called the Insulin Savings Program. Hardly anybody heard about this. And it is huge to help people with diabetes that are having this huge cost for insulin, liquid insulin, that a huge cost for that. The new insulin savings programs, we had a couple of them last year. This year we're going to have about a dozen of them, provide year-round support for the diabetic to get insulin for $35 a month, every single month. Instead of sometimes being $200, $400, $600 a month, $35 a month. It's pretty amazing. It's still not very easy for the consumer to figure out. I can help anybody that needs help with that. But if you go to the Medicare website, you do the plan review where you're trying to check on your drugs, at the top right corner of the screen it says Insulin Savings Program. You click the box and it'll help filter down to just the insulin savings plans. Really matters what insulin you're using. So some people have had to change their insulin from Humalog to Novolog or to Valsalga or other stuff. Now, this last screen here. This shows that everything's a process. If you're deciding to enter Medicare, give yourself 3 months' time, if you can. 3 months before your birthday, 3 months before your retirement date, because it's going to take Medicare and you about a month to apply and get your card. And that'll give you 2 months of relaxed time to talk to your doctors, your dentist, your hospital, and look at your pharmacy options, all that. So then you'll be able to choose your plan so that on your birthday or your retirement date, you're all ready to go. You've got your ID cards. But even if that started September 1st, plan to do your review October 15th, just to make sure that everything's cool for 2022. It's just a process. Just don't call me on September 28th saying you need October 1st, okay? That makes it difficult or impossible, and that's happened before. All right, so here's my company, Affordable Medicare Solutions in Suwanee, Georgia. Our website is amsplans.com. It's on my business card. Each one of you have that. And this card right here, each one of you received, does have a tear-off on the bottom where you can tear off if you wanted to give me your information to talk to you, or you can just call my office and they'll have to intake information from you. And Kevin's staff knows about this, that you would submit your demographic information, your list of your doctors, your list of your drugs, and we have to get some permissions. Medicare requires us to have on file some permission slips for helping you, much like financial planning. So I hope you learned something new today. Let's turn it over for some questions and see if anybody's got questions at this point. I think we stayed right on time, too. Any questions? Yes, sir.
You mentioned about low-income people. How about somebody under 65 who is low income?
Okay, if they're under 65 and low income, they get assistance through the Affordable Care Act. If they're under 65 and are awarded Medicare from disability, not just from being poor, but from having a physical disability, then they get help through Medicare and all these programs. But if they're under 65, just poor, that's what the Affordable Care Act was designed for. Okay? And there's a lot of help, and they just expanded the help. Under the Affordable Care Act, I had a client, a husband and wife, 62 and 63 years old, that made $260,000 per year, and they're getting a tax credit to help them with their health insurance because they got rid of the ceiling cap. So people that are living and playing golf in country clubs are getting government assistance now. This is all part of the Great Society. Next question. Yes.
When you reach 65 and you don't sign up for the prescription drug plan, are you still penalized for that?
Great question. So I'll repeat it for everyone to hear. If you are 65 and you don't sign up for a prescription drug program, are you going to be penalized? That's right? Yes, your penalties are always going to accrue if you don't have alternate coverage. If you're a veteran with VA benefits, you're not going to pay a penalty. If you have group health insurance with good drug coverage, qualified drug coverage, you're not going to pay a penalty. And that group health plan has to tell you every year if it's qualified coverage. If you go bare with no coverage, you're going to be accruing a penalty unless you're low income. If you're low income, there won't be a penalty. But if you're normal, middle income or up, then you're going to definitely have an accrual. It's about 33 cents a month accrual. So about $3.50 to $4 a year, somewhere in there. All right, we had another question right here. Yes?
So I'll be eligible for Medicare in December. Do I need to cancel, or is it done automatically, the insurance? Right now I'm paying an insurance on my own.
Is it an Affordable Care Act plan?
No, it's Kaiser, something that it's not a...
But you just bought it straight from Kaiser?
Yes.
Okay. All right, so her question is, does she automatically go into Medicare? Well, you have to go sign up.
But do I need to tell
Yes,
them
that's
to stop
right. This I'll get to that. Once you receive your Medicare card, then we know for a fact you've got your Medicare started for December 1st. Then you'll want to do it after the 15th of the month. So after November 15th, you'd want to tell Kaiser, I'm not going to need the plan anymore. Don't do it before then. They might backdate it to the 1st. Just wait till after the halfway point of the month, okay?
Because they know my age, so I'm thinking that you still have to tell them.
Yeah, and it's because some people that are on those plans actually are not qualified for Medicare. There are circumstances so they don't automatically cancel people. If you're an immigrant here that has not been here for 5 years, you can't buy into Medicare, you can stay on those personal health plans for the rest of your life if you don't qualify for Medicare. So they don't automatically cancel you. Yeah. Good question. If you're under the Affordable Care Act through the federal marketplace, we have to go in there right at the end of the month to do the cancellation. So we help manage that for people. We actually go into their account online at healthcare.gov, and we then put in the cancellation request. And we'll do that for people, our clients. We do that for them. We just got to know the password and have the permission to do it. Okay? Great questions. And we'll be happy to help you with your Medicare. Okay? This is important. Don't try to figure all this out on your own. You can do a lot of it yourself. That's why I've given you some sheets to do a drug review and those things. But so many false assumptions trap people. Their neighbor tells them something. They think, oh, I'm pretty sure that's the way it worked. That's the way it worked for my mom and dad. No, it changes so often. So don't make assumptions, okay? All right. Any other questions? Yes, sir.
So you're saying this Advantage plan is a legitimate thing by the government? I always looked upon Joe as just a used car salesman.
Joe's making more money today than he ever did. Yeah. Yeah. He can afford 2 fur coats these days. Here's the point. The Medicare Advantage system had some struggles when it first started. You know, there's no doubt. I've been dealing with this for 16 years. And there was companies that came and went. We had a lot of oddball little companies and all. It's a mature market now. It has matured over the last 16 years quite a bit. We're seeing extraordinary stability. We are seeing some new carriers coming into Georgia this year, but a lot of stability. A lot of people were afraid back in 2009, 10, because Obama said he was going to cancel the Advantage program. He said when he was campaigning in 2007, I'm going to cancel that program. Of course, he never did. It's now got 28 million seniors, I think, are under the Advantage plans now. I think it's 28 million, yeah. And growing. Every year they're adding about 1.5 to 2 million people onto the Advantage programs. All right? Other questions? There's pros and cons, whichever way you choose Medicare. There's always pros and cons, and we're here to help you out to understand what's right for you on that. Okay? All right, Kevin, turn it back over to you.